Hello and welcome to the Direct Primary Care webpage. You apparently have stumbled on here and you're wanting some more information about direct primary care. So I hope to deliver on the promise that we will provide you some more information, valuable information. All right, so direct primary care is the name of a national model, actually. We're not a franchise company, but across the nation, there's over 1,300 clinics, several thousand providers performing care under the direct primary care model. Direct primary care is also the name of the family or the membership-based family practice clinic located here in Spokane, Washington. The specifically, it is myself. I'm a nurse practitioner as well as CEO of Direct Primary Care, and then Maria Stoller. She's our medical director and nurse practitioner here at Direct Primary Care, located attached to Holy Family in the third floor of the Central Medical Building. Nationally and here also locally is Direct Primary Care is a membership-based family practice clinic, which basically means for a monthly membership fee, like a gym membership, people get access to all primary and preventative care services included, unlimited office visits, no co-payments. If you get labs done in-house, like urinalysis, strep test, if you get procedures, EKG, sutures, if we do well adult exams, sprain ankle, flu, cold, all that stuff, that's all included under that monthly membership fee. There's no additional charges for those things. That's all ticky-tack charging. We don't do that. We try to provide as much value in that monthly membership model as possible. And we believe that this model really brings into a line patient-centered healthcare, because providers now are always accountable to at least the payer, right? Which in the insurance world means that we have to be accountable to insurance companies. So we spend a lot of time making them happy. Now we don't get to bill their insurance if the patient doesn't come. So yes, we have to be accountable to the patient as well. But under this model, we are only accountable to the patient or the member, and therefore we have to provide high quality care. So we believe that the best way to provide quality care is through not billing insurance, which adds regulations, billing, administrative, and things that really don't provide any value in regards to care. They just kind of bog down the system. With this model, we believe that we can provide a relationship care, which means extended office visits, 30 to 60-minute visits with patients. We like to get to know them, their goals, and not just kind of push our agenda on them. You're always getting care directly from the provider. So if you get checked into the room, it's the provider's doing your vitals, your health history, your medications. It's the provider spending time with you, and that's not being outsourced to some other medical specialist. We also have a decreased member panel under this model. So direct primary care would deal between 600 to 1,000 members per provider, where the national average is 2,300 to a little over 3,000 in some places. So substantially lower. And because of that, we can come through on some of these promises. Direct access. So we believe that great care is when you have great access to a provider when you need to see a provider, right? We do that through 24/7 telemedicine services. So you can text, call, or email, and we are available on the weekend and weeknights. And because you know what? Sometimes when you get sick, it is not at a convenient business hours, banking hours, right? It can happen. It seems to always happen on like Friday at 6 p.m. when it comes to a kid who has an ear pain. And we know that. So you get a HIPAA compliant confidential app where you can call, text, again, email us and say, hey, this is what's going on. And we can say whether you need to be seen clinically or whether this can be handled over the phone. We offer same day, next day availability for injury or illness visits. Again, just trying to help promote great access. All right, pricing, we talked about the monthly membership fee and what's included in that. Also within your membership is extremely discounted labs, medications, and imaging. So through us, you get labs that are about 75 to 85% cheaper, medications that are 80 to 90% cheaper because we dispense those in-house, and imaging we've negotiated 50% cheaper. We're not seeking a profit on these things. These are all what we get them on. We're passing on the benefits to our members to try to keep the costs low for our members and to provide high value. We even have negotiated some specialty procedures with like cardiologists, gastroenterologists, even some chiropractors, right? There's a lot of potential in this model to provide additional benefits on the membership. Here's just some examples of labs, meds, and imaging discounts. I'll let you pause here if you want to review, but you can see it's well within this percent I'm quoting here. All right, so why don't we bill insurance? Well, insurance adds a lot of overhead. Again, it has a lot of times nothing to do with care. It's just about reimbursement. Because we don't need to do that, just a simple model, we can lower administrative burden and pass on those cost savings to our members. We spend less time satisfying those insurance requirements, which means that we can spend more time taking care of our patients, which that could mean calling a specialist, right? Where you're a physician, not a referral agent. So if we need to call a specialist on your behalf to say what would be the appropriate next step, we have the time and the desire to do that. Healthcare is expensive, but you can see through this model, it doesn't always have to be. So kind of in summary, you get unlimited copay-free office visits with your membership, same day to next day sickness and injury visits through 24/7 and in clinic. If you need to come in, you need to be seen, we'll see you. On-call access to a practitioner and provider. It's like a doctor in your pocket through your phone. And then again, extremely discounted labs, medications, and imaging. Here's a breakdown of the pricing. Again, you can pause here if you want to review. Anywhere between $29 to $109, and we do have some couple and family plans that can also be very reasonable. This is basically what you'd pay per month. There's a one-time $100 initiation fee, max of $200 per family. You don't pay that every year. That just kind of gets you in through the door. And we do recommend that you sign up for 6 months so you can get a feel for the service. So what do you do? If you're interested and you're like, yes, Matt, this sounds awesome. I want to learn more. I'm ready to sign up. Go to my DPC clinic on the top right, hit sign up and walk through the steps there. If you want some more information, you want to talk to a human being, dial the number there on the screen and be happy to talk to you. It probably will be me. And if you're interested, like, hey, well, this is great for primary care services. What about major medical? Well, I would recommend you hitting the major medical tab on our webpage to learn out more, to see how you can get a total healthcare solution that includes the excellent care of direct primary care plus a major medical plan. Together, again, that total health care solution is about 40 to 60% less than what you pay through insurance. Well, not too shabby. All right. Well, I hope that was informative. If you have any more questions, please give us a call.